This conference will now be recorded.
Hello.
Namaste all. We are back with the third day of the webinar series Shalakyasidhi 2020, organized by the Association of Shalagi, Kerala chapter, and Department of Shalakyatantra, Ashtamgam Vidyapeedham and Vidyapeedham. Let us start the session with a prayer. I call upon Subhana, our final year student, for the prayer. Subhana.
हृदयरागतन्द्रिमीट्टि स्नेहगीतमेकिं कर्मभूमितलिरिडुन्न വർണ്ണമേകിയും നമ്മിൽ വാഴുമാതിനാമം ഇന്നും വാഴ്ത്തിടാം ഞങ്ങൾ പാടുമീശ്വരങ്ങൾ കീർത്തനങ്ങളാകണേ ചൂടുവയ്ക്കുമീ പദങ്ങൾ നൃത്തലോലമാകണേ കുഞ്ഞു വീടിനുൾക്കളങ്ങൾ സ്വർഗമാകണേ പൂർണ്ണമീ ചരാചരങ്ങൾ ഗുരുവരങ്ങളാകണേ.
Thank you, Subhana. Ayurveda, the science of life, is like a sacred tree which covers and heals ailments through its spreading branches of luscious greenery. And one such branch is Shalakyatantra. Even though it is considered to be a specialty, it is bound to the basics in Ayurveda, similar to how branches are connected to the roots in a tree. So, welcoming you all to the third session of Shalakyasidhi, I wholeheartedly invite Vadiyah, Assistant Professor, Department of Shalakyatantra, Ashtamgam Vidyapeedham, to kindly deliver the welcome speech.
Namaste one and all. Welcome you all once again to the third day of Shalakyasidhi 2020. Namaste one and all. Welcome you all once again to the third day of Shalakyasidhi 2020. It gives us immense pleasure to have you all join us for our session to hear the clinical experiences of eminent clinicians. First, I take this opportunity to welcome today's guest of honor, Professor Dr. Chandala Priyadashini Madam, HOD and Professor Department of Shalakyatantra, GMC Mysuru. Madam is a renowned Shalaki with more than 3 decades of teaching as well as clinical experiences to her credit. With her undying enthusiasm, she is still continuing to inspire many of our students both in India and abroad. With due respect, on behalf of the Association of Shalagi Kerala chapter and Ashtangam Vidyapeedham, I welcome you, ma'am, to the Shalakyasidhi series. Next, we have with us our guest speaker, Vaidhi Manoj Kaloor sir, Chief Physician, Vaidhi Vilasini Vaidhishala. As you all know, sir needs no introduction among Ayurveda fraternity. With utmost respect, I welcome you, sir, to this webinar. Next, I welcome Vadiyah Prasad, sir, our beloved HOD and backbone of our department, and Vaidya Sridevi, my colleague, Assistant Professor and Department of Shalakyatantra. I welcome Prasad sir and Madam to the Shalakyasiddhi Series. Last but not the least, I would like to extend our warm welcome to each and every one of you, our most precious delegates. Thank you, one and all.
Thank you, Dr. Ashwin. It is always said that in unity lies strength. When people of similar ideologies, similar cultures, and similar nature of jobs come together, creativity and prosperity can bloom. That is the strength of an association. The Association of Shalagi is such an association giving a common platform for all Shalagis. Today, we are honored to have Dr. T.R. Shantala Priyadarshini, Professor and HOD, Department of Shalakyatantra, Government Ayurveda Medical College, Mysore. She has to her credits 35 years of experience as a teacher, clinician, and researcher. Her talks have popularized her ideas not only in India but also across the world. She is an epitome of academic knowledge and has rightly been selected as a peer reviewer in Scopus Index journals like Ayu and Journal of Ayurveda and Integrative Medicine. Thank you, ma'am, for accepting our humble request to be the guest of honor for today's session. I welcome you, ma'am, to unmute yourself and speak a few words. Madam.
Namaste and thanks a lot.
Madam, can you please on your video? Excuse me, ma'am. Ma'am, can you hear me? Madam.
Opportunity to be sharing my views.
Madam, you are not audible, ma'am. Shantala, madam. Shantala, madam, can you hear us, madam? Dear participants, I think there is some network issues in her side. I request all of you to wait for some time. She will be joining. Dear participants, Madam is having certain range issues in her side, so we'll be continuing with the lecture session. She'll be joining us later. So moving on to lecture session, as the quote says, Prana pranagridaha yatrashrida sarvendriyanija yaduttamangam shirastadipi dhyate. Shiras is one of the most important angas in the body, as it is one of the three marmas. All the indriyas being situated here and the prana itself being seated. Just how the face reflects our inner thoughts, the head as a whole reflects our health. And we can see that an aching head need not only be caused by a local reason. We have with us the eminent Shalaki, Dr. Manoj Kaloor, to enlighten us with the topic, the differential diagnosis and management of Shiroshoola. Dr. Manoj Kaloor is the Chief Ayurveda Consultant and Managing Director of Arya Vaidya Vilasini Vaidhyashala, Kozhikode, which is an Ayurveda firm with a 99-year legacy with operations in Ayurveda medicine manufacturing, of retailing and Ayurveda clinical services. Academically, he was an outstanding student who secured third rank in graduation from BPSV Ayurveda College, Kottakkal, followed by MD from Ayurveda Medical College, Bangalore. To add to his academic and social profile, he was the former member of Central Council of Indian Medicine, member Board of Studies of AHS, State Executive Member of Ayurveda Medical Association of India and Managing Director of Treatise, Quarterly Scientific Journal of AMAI. He has also served as a professor and HOD of Department of Shalakyatantra, KMCT Ayurveda College, Kozhikode for nearly 10 years. I wholeheartedly welcome you, sir, to start with the lecture session. Manoj, sir, you can start your session.
Hello.
Sir, yes, sir.
Yeah, is it done? Can you hear me?
Yes, sir, it is audible.
Good evening, all. Well, let me thank Shalakyasidhi Association as well as Ashtamgam Vidyapeedham College for inviting me for such a lecture. I thank Dr. Prasad, Dr. Shin, Dr. Sri, all behind this. So with this thought, let me start with my presentation. The thing is that we have only 5 minutes, and the differential diagnosis of headache. You know, it is to be one of the longest in medicine. And you know that headache is one of the most frequent complaints that you always come up with. It is assumed that about 90% of the population there at least once in their lifetime had encountered an headache. And usually in a year, about 50% of the adult population in the world has at least once in their year had an headache. And the thing is that most of the headaches are functional things that will come into this, and it is creating a lot of in the world because it is assumed that about a person who's having 15 or more days a month with a headache comes around 1.74% of the world's adult population. So we can think about the depth of the thing that has been created by headache. And let's come to the Ayurvedic part. The thing is that I will not be dividing like that. I'm just going through the total differential diagnosis, and finally I will come up with the treatment. In Shiroshoola, I'm mainly concentrating on Ashtamgam and Sushruta part. It has been classified in Sushruta as about 11. That is Vadiyah, Paitya, Kavaja, Raktaja, Sannibadika, And Shankaga, Arthaveda, Kimija, Suryavarta, Shaija, and Antava. And in Ashtanga Vidya, this Shaija and Antavada, it has not been told. Instead, Shirakamba has been told, but I'm not mentioning about that because it is not actually, there is no Shiroshoola in it. So we are discussing only about the pain or now. Yeah, I'll just go through the basic differences between the Vadiyah, Paitya, and Kavacha and Rekta Shiroshoola has been told. When you go through the symptoms, you can see that it is exactly what has been mentioned. The text is as per the what are the symptoms that you find in Vadiyah. That is, you will have severe pain in Vadiyah Shiroshoola, but in Paitya you can see instead of pain, it's more of a burning sensation. You will have, and in Kafaja Shiroshoola, you will have more of heaviness. Then and you have a feeling of cold feeling, and you feel that there is something putted in your head and throat. And in Vadiyah Shiroshoola, the headache will increase at night, but in Paitya, because of the cold sun and in cold climate or application of cold, it will come down. And Kafaja also, it will increase at night. And there will be this one hot application or bandaging. The thing is that you will have relief on Vadiyah Shiroshoola, and application of cold will relieve Paitya Shiroshoola. And Rektaja Shiroshoola, it is usually the same as that of Paitya Shiroshoola. Only thing is that you will have you will be very sensitive. You will be having pain on touch, or the pain will be more severe than what you will have in Paitya Shiroshoola. And there are other symptoms that has been told in Ashtanga Vidya more than what has been told in Vadiyah Shiroshoola. It has been explained that when you go through the Ashtanga Vidya, you can see that the Pramartha Gopada, you can see, I'm not going through this yoga. You have the other symptoms like tinnitus, hearing loss, pain in the eyes, or it is usually Suspandanam Vidyapeedham. No, that's different. Here it is that is, you will have a pulsatile type of headache, and there will be giddiness and photophobia as well. And these things you can see in many other conditions as well. Paitya Shiroshoola, that will be usually associated with fever, and the thing is that has been told in Paitya and Kavacha Shiroshoola, there will be a big difference because in Paitya Shiroshoola, it is actually the Shula that is because of the increase in the Paitya property, but in Kavacha, it is more, mainly because of the Rodha due to Kapha, which is. So these are the common differences that you find. So main difference, and you should be very much. It is very much clear that what I have found in my clinical practice, that it is very difficult to find a single entity like Vadiyah or Paitya or Kavacha. Usually, most of the times, or can say more than 99%. The thing is that it will be Vata Paitya or Vata Kavacha or an associate orthodoxa like that. The presentation will be usually like or we come into the and see that as well. Now, next one, the thing is about Suryavarta. Suryavarta is a headache that will, it is because of the Vitanamanda Shankachip Lalade Shumarada, Suspandanam Kudyadan Suryoday. It's a throbbing pain that will goes on increasing from the morning till the midday, then it reduces. And it is as it will increase on being if you are hungry. That is that's why Shuddhada Savisheshada. And without any reason or without uncertain about the object to the Shiroshoola, so we are not clear about it is because of the application of cold or hot that it will come down. So the thing is that and the remaining types of headaches will come in due course. So next is we are switching on to the the modern understanding of headache. And the most important thing in the headache is the evaluation of the patient with headache. And the first and foremost important thing is taking the history. You can come into a conclusion most of the time if you are taking the history properly. Taking history properly means most important thing whether how many times you have had a headache, whether it is repeated thing or is the first time you are getting headache, and it is having a lot of relevance in the diagnosis of the headache. And the associated complaints, whether you come out with whether you had any secondary causes that can into play, whether you are hypertensive, whether you have any medication that has been taken for a long period of time. All these things, it is very much important in taking the history. So history is one of the most important thing in evaluating a patient with headache. And physical examination as well, you know that it is a part of the thing that apart from the functional headache, most of the secondary headaches, you have to go through to rule out that there is no secondary causes. You have to a thorough physical examination is necessary, and after that laboratory and radiologic examination, for sure that is required to rule out that you have any neoplasms or any other stroke or many other causes that can lead to headache. And Ubashayam is very much important because in Vadiyah, Shiroshoola, if you are giving something cold or something, apply cold, it will increase, so that Ubashayam response to the medication is very much important. And the follow-up of the examination, that is to find out whether how the patient is recovering and whether how is the response for your treatment, and all these things are important to go to the next level. Okay, now we'll go to the headache that has been classified in the modern text. As per actually I'm using the tool of international classification, which has been updated recently in 2018. So as per that headache is classified broadly as primary, secondary, and cranial neuralgias. And the majority of the headaches comes under primary headache. And the primary headaches, that itself is again classified as migraine, tension type headache, trigeminal autonomic cephalgias, and other primary headaches. So in differential diagnosis, most important to find out that what type of headache you have. But in treatment perspective, that is an entirely different. So for the diagnosis purpose, we are going through the primary headaches which you encounter in your clinical practice. And I'm not detailing all the types of headache that has been mentioned, only things that I'm going to elaborate is the headaches that can come into your clinical practice. First thing is migraine. Migraine, the thing is that out of the headache that comes to you, about 30% of the cases, 30% of the people are having migraine. And any person who comes to you usually says that I'm having migraine. Migraine, and they will come into a conclusion that they have migraine and they will speak like that. And migraine is a very it's a entity in this. It is having a lot of classification. It has been classified as you can see, that it is migraine with aura, without aura, migraine with brainstem aura, familiar hemiplegic migraines, retinal migraine, then episodic migraine, that is cyclical vomiting, abdominal migraine, paroxysmal vomiting, and the complications of migraine. And actually, menstrual migraine will come under the. It has not been actually classified. There is still doubts regarding that. It is having the symptoms that of classical migraine. We will come into that in detail. And the mechanism of the migraine, the thing is that there are a lot of theories that have been put forward. One is it is because of the cortical spreading depression. That is because of the release of inflammatory mediators, which is leading to the irritation cranial nerves, which is one of the latest theories that has been put forward. And there are many other theories as well. There is another theory called vascular theory that we were using that one as the cause because it is because of the contraction or inappropriate contraction and expansion of the blood vessels, and there is another theory also says that it is because of the low serotonin levels in the brain, which is leading to the constriction and dilation, which trigger a migraine. And there is a neural theory as well that saying that it's because of the certain nerves or an area of the brainstem become irritated, which is leading to release of the substance, which is the cause for the irritation and migraine. And there is another one that says that it is both because of the, it is called unifying theory, which is because of the both vascular and neural influences and the stress, all these things put together leading to migraine. And there are latest theory that there is coming as it says that it is because of the gut microbiota, which is being a cause for migraine. And there is some thought that it may be because of the local inflammation or infection in the nasal mucosa that is leading to migraine. And that one it is in just a thought process that has been happening. And what I feel is that it is having a very good chance, provided that we are getting the most of the headaches, we are getting tremendous result with nausea, which is we are applying most with a free possibility that we are using the drugs that is having lipoperic acid property, which is having a chance to enter to break the blood-brain barrier and enter it, which can be giving a result that yet to find out. So we'll go to the triggering factors of the migraine. Triggering factors, when you go through the triggering factor, you can see that most of the triggering factors that is we told is what is told in the Nidana of Shiroshoola, that is Dhumadavatu Sharam Krida Swapna Jagri Sedadi Purovada Bashpa Nigrahana and Atyama Madhyavana Mir Begadarani Padana Murja Abhinkate Shata Pradesh. The Ashtamgam Vidyapeedham, you can see the Nidana, and most of the Nidana triggering factors that has been told in the migraine that matches with the things that has been told in our text. Now the migraine, the thing is that it is an headache which comes with 4 stages, and it is not seen in all the migraine because most of the migraine comes under migraine without aura, and if there is an aura that is 80 or more than that comes under migraine without aura. And this is the phase that you can see when there is an aura which is coming as part, which was previously called as classical migraine. In that you will have a prodrome, that is in the when you will be having a feeling that you are going to get anything. If you ask the patient properly, when a patient comes with a migraine, if you ask the patient, he will tell that I do have a feeling that I'm going to have that headache, and After some time, he will start seeing the things. If it is a migraine with aura, he will see that something is going in front of the eyes. There is something lighting in the front, or there you can see a black spot or things like that. Maybe it is visual, or you can feel of numbness or weakness that you can see in the as aura. And after that, the actual headache phase will come. And after the termination, you will be having a feeling of tiredness, lassitude, all these things. You can see clearly when you inquire with the patient. And the most common headache that you will find is migraine without aura. And it is classically, you can see these symptoms where the most common thing is a headache. It will be unilateral, and it will be of pulsatile quality, and will be moderate to severe intensity. And the most important thing is that it is aggravated by routine physical activity. When you are doing the thing is that when you have this migraine headache, you will not be able to do any work. You may have to sit, or you may have to sleep, or you may have to take rest. And along with that, usually there will be either nausea or vomiting, or photophobia or phonophobia. Will not be able to look into light. And usually the migraine classical thing is it will last from 4 to 72 hours. And the most important thing is that when a patient comes to you with this type of symptom, and if it is happening for the first time in his life, immediately you should not diagnose it as migraine, because there are many possibilities that it may be because of any other causes other than a migraine. It may be something secondary headache. It may not be a primary headache. So you should be very cautious in diagnosing migraine without aura in the first this one. So that it has been told that at least previously at least 5 attacks should be there to come into a conclusion that the patient is of migraine without aura. And this is one of the common headaches that you will see in your clinical practice, especially when the patient comes with the migraine. And there are when you look at the text, the Ashtanga Vidyapeedham or Sudha, you can see the similar representations as Ardha Veda. I'm not telling that it is exactly, I'm not going to compare one with the other. But what I'm trying to find is there is when you are finding the semblance in the symptoms that has been told in Ayurveda, I'm just showing it in that specific part, so that when you're in your treatment perspective or in your clinical practice, it will be useful. And Susudha, it has been told that Ardha Veda is because of Tirdoshja, that is Uttamangana, Advisable, Sampeda, Thoda, Brahmashura Islam. Patshadashaha Tadavapyagasmas, Ardha Veda, it is happening every 10th or 15 days, and it is having a severe pain. See, Sampeda, Thoda, Brahmashura. Okay. So these it is having pain in one side of the head, which resembles that, and with giddiness and severe pain. And when you are looking at Vadiyah Shiroshoola, as I told you in the earlier this one, you can see all the symptoms, most of the symptoms that you can find in migraine. And here the pain is very severe. Vistudye Brisham Shango Gada Sampidye Tada Madhyam Leladancha Takti Vadivedan. I'm not explaining Vadiyah, another source here you can see that there is a problem with the hearing, then you have a reeling of the head, and you will Suratyari Sirajanam, that's it's pulsatile, and there is there is anugraha, and there is, you can see the photophobia and rhinorrhea. So and you will get relief while if you are mardabam mardana sneha sweda bandesha jayade. That I think it is very clear. Mardanam snehanam swedanam bandesha jayade. So because of mardana, if you are applying oil, or if you are swedana or tying in a strong note, these things will relieve pain. And when you when a patient comes to you, if you ask the patient whether if you press the head for some kind of tie and all, if you have relief of pain, mostly it is because of the Vadiyah Shiroshoola. And in Ardha Vedaka, the thing is that Vadiyah Shiroshoola, if it comes to the right, only one side, it's Ardhe Tumurni Sardha Vedava. Pachat Kupirimasadva Swayameva Chasham. The Adivrudastu Nayanam Sravanam Babinashin. If it increases, it can lead to the problem with eye and ear. It destroys either the ear. And these types of symptoms you can find in the different classifications of the migraine. Come to the next one is migraine with aura. As I've told you that it will have 4 stages. You will have a prodrome, then visual prodrome, then aura. Aura, it may be visual or sensory or speech or motor or brainstem or retinal auras. And it is so the aura usually will be between 5 to 60 minutes. It's aura means usually it is like this: when you are seeing an object, you will see that something else is there, or you can have a loss of perception of one side. You will not be seeing one side, or you will not be seeing. You can see a black spot in between. So like that, symptoms will come. You will have a tingling sensation in your hands, or that is sensory aura. And these types, you will have stuttering of speech, or you will have problem with the speech. This will not last for a long period of time. Maybe 1 hour or so. And these symptoms you can find in different types of migraine. For example, in retinal migraine, you can see in the picture. You can see when you're looking at something, you will see that some black spot or the central scotoma. You can see. You will not be seeing something in between, maybe a monocular scotoma, which can in which the blindness lasting less than 60 minutes or so. So if you are having migraine with brainstem aura, you will have symptoms of the if there is any symptoms of cranial nerve like dysarthria, vertigo, or tinnitus, hyperacusis, or diplopia. And these symptoms last for a short period of time. And if the migraine with aura, with associate with these symptoms, you can call it as migraine with brainstem aura. And only the name implies. The only thing is that most of the symptoms will be mostly for the migraine with or whatever it is. The symptoms will be of headache will be of unilateral, pulsatile, moderate to severe, and you will have a problem with the physical activity, and associated with the photophobia or phonophobia or nausea or vomiting. And there is another classification called hemiplegic migraine auras. In that, you will have the patient who is having this type of symptom usually will have it's like a stroke. You will have weakness or paralysis of one side of the body, or you will have a sensory tingling sensation or numbness in one side, or visual hallucination which is lasting for a period of time, which will come back to normal. The important thing is that it's like a transient ischemic attack that is happening in hemiplegic aura. And if it is, if you are seeing the same types of in your family, it is called familial hemiplegic migraine. And there are many syndromes that is associated with migraine. The thing is that you don't have to, these are all rare entities only for the universal purpose. I'm just explaining these things, not detailing this. If there are patients who are coming with cyclical vomiting, that is intense nausea and vomiting lasting for 1 hour to 5 days, which is repeatedly happening without any other cause. Most important thing is that all these headache or these things should be, you should rule out with any secondary causes, because it is purely functional. It will come back to normal. You are not able to find any other cause, structural or any other cause that can lead to vomiting. And the same thing that happens in the abdominal migraine. In abdominal migraine, you'll have headache, abdominal pain instead of headache. You'll have abdominal pain, which is moderate to severe in intensity. And usually it is poorly localized, and it's associated with anorexia and nausea, vomiting, any of these symptoms. And this thing also, when you have to come to a conclusion that it is because of the migraine, you have to rule out any abdominal causes that can really lead to that abdominal pain. You have to rule out any other causes that can lead to abdominal pain. And sometimes you may have benign paroxysmal vertigo, that is multiple episodes of severe vertigo occurring without any warning. So that also you have to rule out that no other causes that is leading to vertigo is there. And it should always, you should have at least more than 5 attacks to come into a conclusion that this is the diagnosis. And this is about the complications of the migraine. You can have status migrainous, that is the headache that is lasting continuously for maybe days or months. That type of cases usually comes to you because the migraine is headache every day, not instead of 10 every week or every 10 days. Every day the patient may be having headache. It is called the status migrainosus. And other things, migrainous infarction and all rarely happens. It may that you will have a stroke, which can be diagnosed by using MRI. Now, this is migraine that is called the menstrual migraine, which is a common thing that you can see in ladies, usually associated with menstruation. It occurs usually in starts maybe one or 2 days before the menstruation, or can be associated with that, and it occurs more than 60% of this cycle. The classical symptom is headache without migraine, without aura symptoms we see. And as it is associated with the hormone imbalance, because especially the estrogen, the treatment of pure menstrual migraine is somewhat difficult than the other migraine that you will find in your clinical practice. And this is all about the migraine. We'll go to the next one, that is tension type headache. It is very easy to differentiate tension type headache from migraine. Migraine will have one-sided headache. In this tension type, it will be bilateral, and this is one of the commonest headache that you will find in your practice. That is, most of the headaches will come under this category. That is tension type headache. If it is unilateral in migraine, here it is bilateral, and in migraine it is pulsatile. Here it is pressing or tightening type. You feel that something is pressing over the head, and this is usually mild to moderate. Apart from migraine, it is moderate to severe in intensity. And most important thing is that it's not aggravated by routine physical activity. So one who's having a tension type headache, if it is severe also, it will not bother him, so that he'll be doing his work, he's doing his routine activity, and he'll be coming to you saying that he may be having a headache for a long period of time. Then only he'll be coming to you that he's telling about his headache. That's the reason why you should have at least 10 previous headache attacks to diagnose that it is tension type headache. And it is not associated with nausea or vomiting, while migraine is associated with nausea or vomiting. And photophobia, and it is not associated with photophobia or phonophobia, but only one may or may not be present. So this is, if you know the main two headaches, these will be the most of the headache will cover in these two. Either headache with migraine without aura, and tension type headache. And this one usually lasts from 30 minutes to 7 days. And it may be there for more than every other day, like that, in 20 days a month also. And this one actually, if you are, it is more of Vadiyah type, so that when I'll come into the treatment part when you go through this, you can, it is, you will get a very good result with this type as well as. And this is another classification that is trigeminal autonomic sepralgias, and these type of headaches are very rare. I'm just going through it, and it is a cluster headache, paroxysmal hemicrania, SUNCT, that short-lasting unilateral neuralgiform type of headache with conjunctival injection and hearing and hemicrania continua. And the commonest thing in this is cluster headache. The cluster headache, it is a rare entity, but still you can have, you can come across an headache, cluster headache patient. It will be usually severe or very severe unilateral, orbital, supraorbital, and temporal pain. That is, it will be, which is lasting from 50 to 180 minutes when untreated, if it is not treated. And it is usually associated with the symptoms of eyes like conjunctival congestion, lacrimation, eyelid edema, meiosis or ptosis, or nasal congestion or rhinorrhea, or forehead or facial sweating. And this type of cluster headache, the thing is that whatever may be the headache, you are looking at the dosha perspective and treating the patient. Now, this is for your diagnosis purpose, whether to find out whether that is which is coming under whether it is a functional or the structural or the secondary headache. That will give you an insight that what else has to be done. And the cluster headache, what I have seen is in the Ayurveda, when you go through the symptoms of Anandavada, many of the symptoms you can find matching with the cluster headache. So you can see that doshasu dushtastra eva manyam sampidya gadasu rujansu tivrang kurvati sakshi bhuyi shankadeshe siddhim karoti ashishesha kantasya parshe tu karoti kampam anugraham lochana charogam anandavada tamudaharandi dokshatrayotam siraso vigara. Here you can have severe, here it is told that you have severe pain, that not only the where it is told as the brows and temples, it is having the pain in the neck as well, but with the loss of movement of the lower jaw. Associated, I'm not telling that all the symptoms are the same, but many of the symptoms you can find something related, and disease, the underground lojanajam charogam, some of the that is the diseases of the eyes. And here in the cluster headache, you can see conjunctival injection, hearing, then eyelid edema, then meiosis or ptosis, all these things that resembles this one. And there are certain people who are saying that this something related to trigeminal neuralgia, but I don't feel like that. This is my assumption. I'm not going to tell that this is it, but you can find resemblance in this. And when other things, SUNCT and all, these are only the symptoms will be, you can see so frequently, only that difference, that makes the difference. Now, coming to the last part of the primary headache disorders, you can see many of the headaches that has been told as other primary headaches in your clinical practice. One is primary stabbing headache, that is not so common. You will have a feeling that some with a knife or something, there is 2 or 3 stabs on your head, and it will not be associated with any other causes. And primary cough headache, when you are when you have to diagnose primary cough headache, you should have many attacks of these type of headache many times. The thing is that you will have headache when you are coughing, and when you are straining or when you are doing a vessel was maneuver, maneuver, that time also you can have that headache. It's called primary cough headache. And another one is primary exercise headaches. That when you are doing a strenuous exercise, you may come out with a it will be a sometimes severe headache with exercise. When you stop that exercise and after some time when you go off, and it is not sometimes because you should be able to diagnose it properly. Otherwise, it may be because of the arterial aneurysms that is happening in the brain that can lead to when you're doing this exercise can lead to severe headache, which may be because of that. And another headache is primary headache associated with sexual activity. These type of headache you can see previously it was called pre-orgasmal and orgasmal headache. Now it is called headache associated with sexual activity. When you are starting your sexual activity, sometimes there will be a mild pain that will last for a long time and become explosive type of headache at the time of orgasm. And it is not having any structural association. It is a functional headache, but it will be disabling when you are having a severe pain at the time. And another headache is Hypnic headache. In Hypnic, it's called previously it was called alarm clock headache. This type of headache you can find in people who are more than 50 years of age, and this headache when at night when you are sleeping, you will have to get up from the bed immediately because of the pain, and it lasts from 50 minutes or it may last for the whole night, and it is called Hypnic headache. It may you may be having that type of headache more than 15 days per month, and you are not able to find out any other cause. Functionally, it's called Hypnic headache. Then there are few headaches that usually you will have that cold stimulus headache. If you are in a very cold climate, when the temperature is very cold, you can there is possibility of having headache because of the cold stimulus. Or if you are having some ice cream or so, you can have a headache for a seconds to minutes. It is called previously it was called ice cream headache. Called because of the cold stimulus. And another headache is external compression headache. It is usually seen in swimmers. The swimmers they are using swim goggle. Previously, it was called as swim goggle headache. When you are using goggle for a long period of time, more than 1 hour or so, you may feel headache. But when you remove that after some time, it will be relieved. And there is possibility that that type of headache can come in this COVID era because we are using face shields, which may compress externally. If you are using for a long period of time, that can cause, but it has not been notified so far. So it is not there in the text. There is a possibility that it can come in the future. Now we'll go to secondary headache types. Secondary headache may be because of many causes. As the text says that it may be because of head trauma, infection, non-vascular intracranial disorders, cranial vascular disorders, substance orders, withdrawal, disorder of homeostasis, disorder of cranium, neck, eyes, ear, nose, sinuses, teeth, mouth, or psychiatric disorder. I'm not going in detail all those things, but some of the things that come across in your clinical practice. One is headache due to trauma. These things you can see when a patient, when a person who had an injury to head or head trauma, he may have develop an headache after 1 week or so. And the thing is that when the may get resolved maybe within 3 months or so. Usually, if it is acute time, if it is chronic, it can last for a month or maybe year together. And this one, similar thing has been told in our text as Shiroshoola as Basavala saw Shadasambhavanats because of Shadasambhav, because of the injury to the head, which is leading to a difficult or severe pain, which increase on Vada increasing factors like Samsedana, Chardana, Umana, Domanasye, Asukmimokshe, it's because of all these things it can increase. And what I found is a person comes with an headache of because of an injury, you can treat like a Vadiyah Shiroshoola and you will get excellent results if he is having continuous headache because of any injury to the head. And next one is hello.
Sir.
Hello, can you hear me? There is.
Yes, sir.
Oh,
We can hear you, sir.
yeah, there was some problem. And next one I would like. Next one is Shankagam. Shankagam that has been told is Shankaga that has been told is through the Ashtamgam. There is some difference in the symptom that has been mentioned. In Shanga, as per Susudha, it is severe pain, which is because of the dosha as well as vitiation of recta, which is especially in the temples. So in that, it is told that if you try to treat this with whatever, it's very difficult to cure and it may lead to death within 3 days. Okay, and these type of headache, what I feel is you can see in the present scenario, you can see the secondary headaches. If there is a headache attributed to subarachnoid hemorrhage, you can have a severe headache. It's called the never experienced pain in your lifetime. Like that severe pain, you can come with stiffness and other symptoms like photophobia or blood vision, and it can lead to death if it is not treated immediately. And there is every possibility that the Shankaga that is mentioned is having somewhat resemblance of this subarachnoid hemorrhage or hemorrhage of the aneurysm. In that, you will find this at that point of time, it may be very difficult to treat such conditions. That may be the reason that the patient dies immediately. Now we usually are able to treat such patients with the present. And in the present scenario, these types, if it is treated properly, the headache will resolve within 1 month. And the Shankaga that has been told in Ashtanga Vidyapeedham, here also it's a severe condition which is leading to the headache, which if it is not treated immediately, it will lead to death within 3 days. And here the symptom is associated Tivra Daha Rujaraga Pralaba Jaratritraban. That you have severe burning sensation is there, severe pain is there, you have disorientation as well as fever. And these types of conditions which last, you can find in the meningitis. For example, bacterial or viral meningitis will have a diffuse pain which increases in intensity, which is associated with a sudden high fever and stiffness. And if it is not treated immediately, it can lead to that associated with nausea, photophobia, or phonophobia. So presently, the bacterial meningitis, if it is treated immediately, you will be able to resolve within 3 hours or 3 months after the relief of meningitis. And at that time, it is possible that these type of symptom when it comes, it may be difficult to treat, so that it can lead to death. So again, I'm telling that I'm not telling that this is it, but it resembles that. And these are type of the headache attributed to neoplasm is also usually patient will or may come to you. It is usually the headache that is in line with the where neoplasm is, and this is usually progressive, and it will be worse in the morning. It is usually says that it's morning headache, and you'll have pain on lying down, and it is aggravated by vascular like Manoj, which is usually associated with nausea or vomiting. And these things you should not overlook. The patient comes with an headache, or you should always think about the possibility of a neoplasm. You should be very careful in coming to a conclusion about the headache, because these things has to be treated with an emergency. And there are other headache that is associated with that is alcohol use, the substance use or withdrawal, whatever it may be, because of the alcohol or the medicine that you use, or if you are suddenly withdraw from the medicine or from the things that you use. Probably I will come to the thing is that alcohol induced headache, you can see many people that is associated with ingestion of alcohol. First, it develops when you start drinking, and hangover headache, that is most common. People who drinks more than a high dose of alcohol, they will have next day morning they will come out and say that they will have headache. That's called hangover headache, and it is usually bilateral, frontotemporal location, and pulsatile, and aggravated by physical activity. So you can call it as it's a combination of tension type headache and migraine symptoms. The thing is that it is aggravated by physical activity and it's pulsatile, and the other thing, it is bilateral. So, and the alcohol-induced all these headaches will get relieved when it is stop that, or sometimes in the hangover headache, they need a small pint of alcohol again, as nowadays it's called Vadiyah. So then they relieve that, or you have to stop completely. And other thing is that these headaches are also called that is medication overuse headache. Medication overuse headache, it may be because of the analgesic that you are using. Sometimes the patient comes to you, he may be having headaches for a long period of time, and he may be using the painkillers regularly every day or every other. That is a patient, if he is using more than 15 days per month for 3 months, you can have analgesic headache due to analgesic. That is typical will be the symptoms of tension type headache. And here, what you have to do is immediately you ask the patient to stop the analgesic, and you can start your medication, and headache will resolve within 2 months after this. And triptan is a drug that is being used in migraine, and the same drug, if you are using it for a long period of time, that will lead to symptoms the same as that of migraine. So when a patient comes into migraine, is using this for a long period of time, and the patient is still continuously having the headache, you can ask that whether the patient is using that again and again. And if it is continuously using, you have to stop that medication, and that itself may lead to the relief of his headache. And the headache attributed to substance withdrawal means if you are using regularly the caffeine consumption for more than 2 weeks for more than 200 mg, it can lead to caffeine withdrawal headache. And if you have that headache, immediately if you give 100 mg of caffeine, then that itself will relieve the headache. Otherwise, it will resolve within 3 to 7 days. Same thing will happen with the usage of estrogen. Estrogen, you can see the in the gynecology, many will be using this exogenous estrogen. That will, if you are withdrawing that immediately, that can also lead to headache, but it will resolve within 3 to 7 days. And there are certain headaches that is related to homeostasis, that is hypoxia, hypercapnia, dialysis, arterial hypertension, fasting. All these can lead to headache. And there was some of the common thing that you will find is high altitude headache. If you are going to an altitude more than 2,500 meter high, when you are climbing a mountain or something like that, or you can have a bilateral mild to moderate intensity headache, which is aggravated by exertion. And when you come down or when you descend, it will come down. It is called high altitude headache. And another one is headache attributed to fasting. This one, when a patient or a person fasts for more than 8 hours, in Ayurveda, you know that Lankanam has been told. Sometimes if you ask a patient to do Lankana, if he's having headache, if he is laying for one day, if he's headache, it may be because of the headache attributed to fasting. It is usually in frontal location and non-pulsatile and mild to moderate. And if you stop fasting, it will go off after some time. And another headache that usually comes to you will be the headache because of arterial hypertension. When the BP systolic pressure is more than or equal to 180 by 120 or more, then there is possibility of developing an headache, the temporal relation to the onset of headache. That is hypertension. If the pressure increases at that time, hypertension worsens. That time it worsens when it is relieved. The hypertension relief. So when a patient comes to you with headache, you should always see whether the BP is normal or not. And the headache that is associated with the structures or cranial structures, or it is that is also one of some of the commonest things that you will encounter is a headache associated with the glaucoma. The patient who is having acute ankle closure glaucoma, the patient will be having pain, or headache, whatever may be the thing. It is not having any peculiar, whatever the headache that is having, it will be having. The location includes the affected eye. That in the pain in the eye will happen in the eye. You have to check the pressure and see whether intraocular pressure is normal or if there is any condition that is related to glaucoma. You have to rule out that. And the headache that is related to refractive error. This is a common thing that you see near clinic. The refractive error, the headache will be along with the aggravated by the prolonged visual task, where the visual impairment is there. And it will be relieved when you are able to correct your refractive error properly. So this also, it is a common thing that you will see in your clinic. So the important thing is that you have to rule out that the patient is not having glaucoma, any refractive error, and most important thing is sinusitis. Sinusitis, one of the most important symptoms that you will find is headache, which is in line with the frontal or ethmoidal headache or maxillary sinusitis. In frontal headache, you will see the acute headache. You will have a headache in the morning. Usually, it is called previously it was called as office headache. Headache which will start in the morning. It will go up till the moon and it's come down. It is in line with what we will see in the Surya Varta. It's headache which is starting and it is coming down in the afternoon. And headache, it will increase on giving on applying pressure on the sinuses, paranasal. So that already, if you have a doubt that the patient is having sinusitis, you palpate the sinuses and see whether there is any tenderness, and you can usually go for PNS or CT or whatever it is. And last part is the headache associated with the cranial and other facial pains. And the most important thing in that is first is trigeminal neuralgia, then glossopharyngeal neuralgia, painful optic neuritis. All these will come under the cranial nerve issues. Okay, and the mechanism of cranial neuralgia, it is because of the compression of the cranial nerve by maybe by the blood vessel itself, which is leading to which will lead into severe pain. In this trigeminal neuralgia, you can see severe pain which lasts from a second to 2 minutes, which is having severe intensity, and it's like shock, like shooting or stabbing or sharping quality. And it is precipitated by a non-harmful stimuli, like basically if you are touching your face, and if you are brushing your teeth, or even if you are wearing your goggles or whatever it is, it can lead to severe pain, which is one of the very severe conditions that you will encounter in your life. And this is here you may have to. If you are doing the treatment properly, you will get very results in this one as well. And in the glossopharyngeal neuralgia, the symptoms will be same as that trigeminal neuralgia. Only thing is that the location will be different. You will have pain in the tonsil and the ear, or in the branch of the 9th cranial layer, that is here. And the last one is painful optic neuritis. The painful optic neuritis will have pain which is aggravated by the movement of the eye. And if you have a doubt that it's having the painful optic neuritis, you have to check the patient properly and see whether ask the patient whether if there is pain on the movement of the eyeball, and you have to look at the fundus, or you can in the neuropathy you can consult the patient, or see the headache will be unilateral or bilateral, retroorbital, frontal or temporal pain, and it will be usually severe. And these are the common headache that you will encounter in your clinical practice. And treatment, what I would like to tell is this is just a few points that I would like to enlighten with my clinical experience. Thing is that I made a treatment plan which I usually follow. And it is classified as Vadiyah, Vadiyah, Kavacha, and it is not exactly that all I'll be getting all the Vadiyah, Shiroshoola, or Vadiyah. It is the combination, or the most of the time combination. It is coming 90%, as I've told you, 90% of the time it will be like that. And usually, what I give it as I made this one. Study in the sense in about some 300 patients, and with the Shamana treatment, and what I've given in these patients, that's what I'd like to explain. Vadiyah Shiroshoola, usually I give Vidyapeedham, Kashaya, Vidyapeedham. The thing is that usually at night, as in Ashtamgam Vidyapeedham has been told, that same thing as per the classical thing given with Shirabhaga, either Bela, Ashwagandha or Masha. And usually for Shiro Abhyanga, usually I give Masha Taila, which has been told in Ayurveda Kalpadruma or Balahadadi Taila. And most important thing is that if it is Shamana treatment, it's Padimarshanasya, usually Varnadi Shiragada, which is being given. And most of the cases, what I found is the most important thing in the practice of Shiroshoola is the application of Nasya. Nasya gives tremendous result without doubt. And if it is going for Shodhana, this is the mode that I usually follow, with Snehapana, with any of this. And after that, Swedana, Shividaduma, then Virena with Nita, that is Muthu Samshodhana, and Nasya with Varnadi Shiragada, and Shirovasti or Dara with usually with Shiravada. And these are some of the drugs that is sometimes we switch on to the Shira Dara, which is having very good result, and Tuma. And in Nasya, it is most important thing is that you have to do Kabalam and Duma with Nasya, otherwise it may lead to again headache. So it is most important thing is that you dry the nose after the Nasya. And Shiro Abhyanga, these things are common. You can find in any of the Vada Shamana or Vada Pitta Shamana, you can use it. And these are the some of the drugs, and already it is linked. So, and then Pathiitis, Masha, Mudga, and all it's been told in the text. That is what I also follows. Gives good result. Paithika Shiroshoola, is Patyaksha or usually give Mudhu Samshodhana with Avipati or and along with that usually there will be gastritis. If there is Pitta predominance is there, usually you can find gastritis or giddiness type symptoms, or that gives Sudashegara or Kamakarasa. Along with the Siro Abhyanga, I prefer to give Amadasana Saradi, which has been told in Aragal Padruma, or you can prefer any other Sanayadel or many other of Pitta Shamana. Basically, and Shirabhaga with Yashti Madhu, Bala Jivati, which is used, which is all not a specifically for Pitta, but along with that, other doshas also be taken care. And the Pratimarsha said Gridamanda is very good. That's what I have found. The Paithika Shiroshoola, this one, for Shodhana, these type of regimen I usually follow with Snavana with Mahatikta or Kalyanaka, Shedana, Shiraduma and Virena with Ayurvedic, Rasha classical with Virajana, Nasya with Udamanta. And by this, all these drugs can be used on this one, for Dara. And Shiravada can be done, then Nasya with any of the things that has already been told. And next one, Kavacha Shiroshoola, usually if it's Kava predominance is there, I will tell you again, it's all predominance, it's not exactly complete. If the predominance are usually for Varnadika Shaya with Kanchanari, Rushoshna Thaila, Marijapatradi, that's found to be useful for me. And Tala with the Rasai Chopra and Imarsham, usually if this kapha predominates, like this heaviness of the head, and if you have a feeling of coating in your throat and things like that, usually prefer Tulsi Sarasa with Karpura, which gives good result. Only thing is that after immediately you don't have to continue with this 1 or 2 days. If the kapha is relieved, then you can switch on to the Thaila Nasya with Anuthaila or as per the condition case. And in the Shodhana, here you can do after Snehvana, you can do Vamana, then Vedana and Virajana and the Nasya, you can do Pranasya as well as. And these are the things that can usually, sometimes you can use Nimbasava and Saitava and Nasya. That is having very good results, even if there is a sinusitis and associated with that. And most of the times you can see patients coming to you with as I told you, Vadiyah, Paithika, all this put together. And if you are looking at the modern this one, can see patients with migraine, with tension type headache, and with sinusitis, all these together. So as per the merit, you can treat the patient. And I made a small one. I made a small study. You cannot say it as a any randomized study or something like that. When I've seen some 300 last treated some 300 patients. I've just gone through it. I've seen about 37% of patients comes under the age of about 31 to 40, and 19% between 21 to 30 and 45. So most of the patients are coming between 21 to 50. And frequency of the headache, the patient that has come to me, about 75% of the patients had headache every 1 week to every day. Daily, it is most of the patients, about 38% was having daily headache. And when just getting at the results of the patient, the thing is that more than 80% of the patients got very good result, and 30% have not turned off. I'm not sure that whether they got completely relieved, because turned off in the sense many of these things I have followed up to more than a year, and what I have found is those who are having daily headache, the results are wonderful when you are doing treatment with nausea, and when you are doing a proper treatment, you are getting very good result. And why I have written it as 65% reduce means when the patient who is having everyday pain, the recent 1 year, they have at least reported once or twice or thrice or 4 times they had a headache. And really means that they never had a headache in the all this time. And the 6% I don't the total the group I have figured, I don't find it result. And with this, I let me finish it. Class, thank you. And it is actually the time is short, so I know that class was very fast, and this I end. Thank you.
Thank you, sir, for the informative session. Now I request the participants to ask their queries either by unmuting your microphone, or you may even post your questions in the chat box. Sir, there is one question. Is there any chance of occurrence of headache due to multiple causes, like migraine and sinusitis headache in same patient? If so, what treatment? If so, what treatment we should adopt? Sir, please unmute your mic.
Yeah, that's what I told.
So we cannot hear you, sir.
The intensity of the pain. For example, if the patient, yeah, it is unmute only.
Sir, you are not audible.
You can't, can you hear it?
Now we can hear, sir. Now we can hear.
Hello.
Yes, sir. Now we can hear. Now it is audible. Now it is audible, sir.
Hello.
Yes, sir.
Can you hear me? Hello.
Yes, sir. Now we can hear you, sir. Sir, it is audible.
Hello.
Sir, it is audible, sir.
Hello.
Sir.
Hello, sir.
Hello.
Sir.
Mic is on mute only.
Sir, we
Can you hear me?
you. Yes, sir. It is audible.
Okay. Okay. The
Sir,
thing is that when it usually comes like that, the patient. Hello.
Yes, sir. Yes, sir.
Many a times patient comes with migraine with the frontal. Can you hear me?
Yes, sir.
Hello.
We can hear you, sir.
Yeah. Okay, so I'm answering. Your question is like this now: whether a patient can have both migraine and sinusitis, right?
Yes, sir. Yes, sir.
Hello. Hello, കേൾക്കുന്നില്ലേ?
Sir, video ഒന്ന് ഓഫ് ചെയ്യോ, sir?
കേൾക്കുന്നില്ലേ? Hello.
കേൾക്കാം സർ. സർ സാറിന്റെ വീഡിയോ
Okay. And so question was like this. Now, whether a patient can have migraine as well as sinusitis, how to treat, right?
Yes, sir. Yes, sir. Whether it both migraine and sinusitis, sir. Whether
Hello?
both migraine. Sir. Hello.
Yeah.
So the question was.
The thing is that usually patients come with most usually many times patients come yeah, patients comes with headache which is having the patient may be having migraine. Along with that, the patient may be having sinusitis. Okay. So when the patient comes to you like that, you see whether which one is having more problem the patient.
Sir, your voice is breaking.
Sinusitis having is if he is having more problem with the sinusitis first, video.
Okay.
Okay,
Clear
sir.
on.
Okay, sir. Clear answer.
Sir. Parnolu.
Yeah. Migraine and sinusitis is more disabling. More with the sinusitis. Hello.
Sir, പറഞ്ഞോളൂ sir. പറഞ്ഞു sir. Clear ആണ് sir. Okay, sir.
Not clear. ഇപ്പൊ കേൾക്കുന്നുണ്ടോ? The thing is that if you have a headache, both with the patient with migraine is having sinusitis, you see the patient whether which is more disabling. The thing is that which is creating more problem for the patient. If it is the migraine, you treat migraine first, and if it is sinusitis, you treat that one first. Okay. And you have to make sure that it will not increase the other disease. For example, if it is usually if it is sinusitis, the patient will be having more of kapha predominance will be there, and sinusitis, this migraine also it may be Tritoshya or maybe only Vadiyah. So when you are treating the Shiroshoola or this one sinusitis, you have to make sure that it will not increase the other one. Okay.
Sir, another question. How do you manage substance withdrawal headache? For example, coffee.
Substance withdrawal headache means if you withdraw that, for example, caffeine. Caffeine, if you withdraw that, you are immediately when the headache comes, you have to give. If you give 100 mg of caffeine, it will come down. If it is because of the withdrawal, otherwise it will be resolved within 3 to 7 days without any. Or the treatment for that is what has been told is if it is whatever that is withdrawn, it will be relieved within few days. It will go, or whatever that is you have to give a small dose to make sure that the headache is relieved at that point of time.
So another question. Can we administer Nasya for Suryavarta type of headache? What drugs can be given for Nasya?
Yeah, definitely, because Nasya is the treatment for headache. All the Shiroshoola, if you do Nasya, you are going to get the result, because what I found in my clinical practice is about more than 90-95% cases you are getting good results if you are doing Nasya. So if it is Suryavarta, it is more of it is Pitarvada Sankashapura Shumarda. So Pitarvada means you can administer Nasya, that is related to the, you can use Kridamanda or that people that, and that's what I also have found.
Sir, another question. Can you please explain about the role of Agni Karma in Shiroshoola?
The thing is that the parasurgical measures is having, example, Agni Karma is having a role in the Shiroshoola, especially the migraine. Migraine, you are doing it in the head itself in the near to the temple, temporal side, and usually the pain gets relieved immediately after doing the Agni Karma. What I've seen is, I'm not doing it regularly in the practice, but whenever it is done, I've found very good result in that, especially in this temporal area.
Sir, another question. Can you please share the reference of Nassim with sugarcane juice and ginger?
Actually, the thing is that it has been used. It is not classical reference, but it has been used. The thing is that if you are using if a patient is having severe headache, unbearable pain and all, it is like it's like a counter rotation. If you do Nasya in a small quantity with the ginger juice, either 2 or 3 drops, immediately the pain will come down. That I've seen in migraine headaches. When a patient comes to you with severe pain, if you do either 2 drops is enough, 2 or 3 drops, immediately that is for it will not last for a long period of time. Sometimes it will go off immediately, but the second time, if it is happening again and again, it may not be any result. It's usually to give relief immediately. We used to do that. And immediate relief will get on the patient who is big. And another thing is that if we are doing it repeatedly, you may not get it as well. For example, if the patient is getting again and again, if we are doing it again, you may not get it.
So another question. Is daily administration of Anutailam advisable for headaches?
Yeah, you can do it. Daily Padimarsanasya, you can do it. Yeah, you can regularly, you can do it. No problem. As for the, not even that one, if the Kapachasi Rishula and all, they are using Nipasa also. Many times, regularly, sometimes people uses that, and are getting very good result after this long time. Anuthala, you can do it regularly, and you will get good result as well. And if it is Marsha, then as per the text, you can do it. But Padimarsha, you can do it. And you will get what my feeling is, Nasya, it is having a tremendous result in the sense it may be acting in the it may, I'm not sure that it may be going beyond what we imagine, maybe going to the brain itself, because it contains means it is having the thyla means it will contain the property of both lipophilic as well. Drugs that can enter the blood-brain barrier. So there is every possibility that it can act near the brain itself. So a lot of study is required. So, but from the results, what we find, and the text also it has been told, but I'm looking at the other perspective that it is definitely giving wonderful result than what we before. And then headache, without doubt, any patient comes to you, you hesitate to do nasya properly. And important thing is that after nasya, you have to do kabla and that is important. Otherwise, especially if it is marsanasya, most of the time the headache may aggravate or it will increase. So, because of the initiation of kapha, that you have to make sure that it is done properly. Nasya is done properly.
Sir, what are the other single drugs for immediate relief of pain?
Single drug for you mean for nasya? Nasya immediate relief of pain. We are doing if there is tulasi sorasa with karpura. If you do nasya in certain, even in sinusitis, it's a immediate relief in the sense if you have severe pain, if you do nasya, if the you will get immediate relief or period of time. And the thing is that if it is completely the vitiation of kapha or the symptoms that has come down, then you can switch over to the other nasya. What I've found is nasya, you don't have to stick to a specific nasya for a for example, if you are doing marsanasya itself, you don't have to continue with the same medicine for 7 days. It depends on the condition. You can change the medicine within after 2 days or 3 days. It depends on the look at the symptoms and to see whether there is if it is predominance of kapha is there, if it comes down and kapha is relieved, and if you feel that it is more of Paithika or Kavacha, then you can Vadiyah, then you can switch over to the other medicine that is apt for that. So it is not mandatory that this has to be continued for 7 days or continued for many.
Sir, actually, there is Dr. Aishat has asked you to repeat the first answer for the first question. That is a treatment of multiple cause headache, sinusitis, and migraine.
Okay, the treatment of multiple thing is that treatment of multiple. This one means you many times in the sense it's not regular, but many times the patients will come with multiple things like you may be having this one tension type headache with migraine and with sinusitis. So first thing what you have to look at is which one is creating more problem to the patient. If the patient say patient's problem is more of, for example, a patient is having migraine, he is getting migraine attack every 15 days, and if he's having sinusitis, if he's having every day that pain is there because of the sinusitis, you first treat that one. You treat sinusitis, and after that you go for the other one. And sometimes it may be the thing is that one. And make sure that if you are treating one, it is not aggravating the other one. So that only you have to look at. Otherwise, which is more disabling to the patient, you get that one. That is it.
Sir,
And the treatment of sinusitis, the thing is that you have to look at the perspective of which dosha is predominant. Most of the times it will be kapha pitta predominance will be there. So you have to treat accordingly. You have to make sure that if there is a lot of sinuses are blocked, and so that you may need a Tishna Nasya. Nasya usually in that even asavas and all are used. Many times it is giving very good result as well. And Nasya is used at that time. And whether to continue that or not, you have to look at the, you have to take the CT or you have to take the PNS X-ray and look at the symptom. And not only that, sometimes the thing is that you may most important thing, the presentation of the patient. Patient feels that he is having symptom. That is the most important thing. If you are not finding it in CT or MRI, also it is not mandatory. But the thing is that how the patient feels. That is the most important thing. So look at it and treat accordingly.
the next question. Can you explain the action of Marma therapy in Shiroshoola?
The thing is that actually what I can tell is I'm not an expert in Marma therapy. What I can say is when you are doing Nasya, Pratimarsha Nasya, you are actually stimulating about 20 or more than 20 marmas. When you are doing applying oil, when you are massaging, when you are doing this thing, you are massaging all over the marma, that is especially in the head, and you are applying the oil or stimulating your legs and feet and hands. You are stimulating marmas there as well. So in that perspective, when you are doing marma, you are actually stimulating many marmas that may be helping in the total our treatment process.
Another question. Is there any instant relief drugs for treatment of depression headaches or mind-related headaches?
Mind-related headache, any?
If instant relief drugs are
instant relief for mind-related, it will be difficult. The patient may be having so many problems with the mind. You have to take care of that. You don't have any immediate thing that can give relief to your mind. Is there anything like that? I don't know. How can you control your mind with a single drug? I don't have any experience in that.
So last question. Sir, regarding the action of application of Rakta Mokshana in Shiro Roga.
Yeah, Siddhavedam has been told in especially in Paitika Shiroshoola, not in Vadiyah Shiroshoola, it is contraindicated. And if the Vadiyah Shiroshoola, if it is associated with Pitta and Rakta, also you have to, it has been told that you have to take care of that. But in if it is more of predominant Paitika Shiroshoola, then Siddhaveda is indicated. But I don't usually do Siddhaveda in practice.
So that is the questions are over, sir. So moving on to the concluding session, I invite Arya Suresh, final year student, to deliver the vote of thanks.
Namaste. Honorable resource person, respected teachers, organizing committee, delegates, and my dear friends, a warm good evening to one and all. It's my privilege to propose vote of thanks on the closure of this third session of Shalakyasidhi 2020 webinar series organized by Shalakyatantra Department of Ashtamgam Vidyapeedham and the Association of Shalaki Kerala. I, Arya Suresh, on behalf of Ashtamgam Vidyapeedham and TAS Kerala, first of all would like to thank Almighty God for making today's event a great success. I would like to extend my most sincere thanks to Dr. Manoj Kaloor sir, Chief Physician, Ayurveda Vilasini Vaidyashala Kozhikode, who spared time from his busiest schedule for us. Thank you, sir, for your very informative talk on differential diagnosis and management of Shiroshoola. I would like to thank Professor Dr. Shantala Priyadarshini ma'am, HOD, Department of Shalakyatantra, Government Ayurveda College, Mysore, for accepting our invitation as our guest of honor. But unfortunately, due to network issues, ma'am tried to but couldn't join us for the session. Thank you so much, ma'am, for your support. I thank Vadiyah sir, Assistant Professor, Department of Shalakyatantra Ashtamgam Vidyapeedham, for the welcome address. We are extremely grateful to our Shalakyatantra department. I thank Vaidyan Prasad sir, HOD, Department of Shalakyatantra Ashtangam, Vaidyan Ashwin sir, Assistant Professor, Department of Shalakyatantra Ashtangam, and Vaidyan Sridevi ma'am, Assistant Professor, Department of Shalakyatantra Ashtangam, for providing us such great opportunity. Last but not the least, I would like to thank all delegates and all dear friends for your keen participation, which made this event a resounding success. Thank you all.
Thank you, Arya. So before winding up the session, to have a word about tomorrow's topic, tomorrow's lecture session is on differential diagnosis and management of Shiroshoola. The session will be dealt by Dr. Bijumon OC, Associate Professor of Department of Shalakyatantra, Government Ayurveda College, Trivandrum, at 3 p.m. So hoping to see you all tomorrow. Thank you.